Next Gen NCLEX PN practice questions. Question 1. When collecting data about a client pain, what is the first step in the pain assessment process for the nurse? Option A. Accept the client report of pain. Option B. Get a detailed description of the location and intensity. Option C. Have the client identify current coping methods. Option D. Determine the exact physiological cause of the pain. The correct answer is option A. Accept the client report of pain. Pain is subjective, and the first and most vital step is to validate and accept the client report of pain before proceeding with a detailed assessment of intensity and location. Question 2. Which of the following client room assignments should the nurse question to ensure patient safety? Option A. Placement of an 89-year-old client with acute delirium at the end of the hallway. Option B. Placement of a client with Clostridium difficile with another client with the same infection. Option C. Placement of a client with human immunodeficiency virus in a private room. Option D. Placement of a client with mild head trauma with a client who has a fractured arm. The correct answer is option A. Placement of an 89-year-old client with acute delirium at the end of the hallway. Clients with acute delirium are at high risk for falls and safety events. They should be placed in a room close to the nurse's station to accommodate close and frequent monitoring. Question 3. The nurse knows it is critical to monitor a client use of complementary and alternative medicine because Option A. Complementary therapy could interact dangerously with prescription medications. Option B. Most complementary therapies are essentially ineffective and a waste of money. Option C. Additional medical treatment is never needed if the client is using natural therapies. Option D. Clients must be warned that all natural therapies are inherently dangerous. The correct answer is option A. Complementary therapy could interact dangerously with prescription medications. Natural does not always mean safe. Herbal supplements and alternative therapies can have severe, dangerous interactions with prescription medications like insulin, warfarin, or digoxin. Question 4. The nurse is visiting the home of a client with a Clostridium difficile infection. Which infection control measure must the nurse include? Option A. Obtain vital signs with a disposable blood pressure cuff. Option B. Ask the client to wear a surgical mask during the visit. Option C. Interview the client while maintaining a strict 3-foot distance. Option D. Use sterile gloves when performing routine venipuncture. The correct answer is option A. Obtain vital signs with a disposable blood pressure cuff. Clostridium difficile is a spore-forming bacterium transmitted via contaminated surfaces. Using disposable equipment, like a blood pressure cuff, prevents the transmission of this pathogen to other clients. Question 5. Which of the following would be the absolute priority action for a nurse who sustained a needle stick injury while working with a client who has acquired immunodeficiency syndrome? Option A. Start prophylactic zidovudine treatment immediately. Option B. Make an appointment with a staff psychiatrist for trauma counseling. Option C. Contact a social worker right away to discuss workers' compensation. Option D. Wash the area with a highly concentrated bleach solution. The correct answer is option A. Start prophylactic zidovudine treatment immediately. Zidovudine is a critical antiretroviral medication. Starting post-exposure prophylaxis immediately reduces viral replication and is the highest priority to prevent human immunodeficiency virus transmission. Question 6. Which stage of psychosocial development does the nurse know a 2-month-old infant will be experiencing? Option A. Trust versus mistrust. Option B. Initiative versus guilt. Option C. Industry versus inferiority. Option D. Autonomy versus shame and doubt. The correct answer is option A. Trust versus mistrust. Trust versus mistrust is the psychosocial stage for infancy, lasting from birth to 18 months. Infants develop trust when caregivers provide reliable care and affection. Question 7. The nurse is caring for a client scheduled for a thyroidectomy. The nurse understands that the primary reason for giving potassium iodide solutions preoperatively is to Option A, reduce the size and vascularity of the thyroid to prevent hemorrhage. Option B, decrease the risk of severe granulocytosis postoperatively. Option C, prevent severe tetany while the client is under general anesthesia. Option D, potentiate the effect of anesthesia so less medication is needed. The correct answer is option A, reduce the size and vascularity of the thyroid to prevent hemorrhage. Potassium iodide reduces the size and extreme vascularity of the thyroid gland, which is crucial for limiting intraoperative bleeding and preserving surrounding nerves and the parathyroid glands. Question 8. A client in the emergency department shouts, "I am going to kill myself because they are coming for me." Which response utilizes therapeutic communication? Option A, "You are safe here. Can you tell me more about what is happening?" Option B, "Please do not try to kill yourself. We will sedate you if we have to." Option C, "Why would you want to kill yourself?" Option D, "Who exactly do you think is coming for you?" The correct answer is option A, "You are safe here. Can you tell me more about what is happening?" This statement uses therapeutic communication by first establishing a sense of safety and then using an open-ended question to gather more information about the client paranoia. Question 9. The nurse is discussing varicose veins and at-home management with a group of clients. Which intervention should the nurse reinforce? Option A, wear compression stockings during the day. Option B, when sitting always keep your legs lower than your heart. Option C, participate in activities that require standing for long periods. Option D, take a daily low-dose aspirin to prevent new varicose veins. The correct answer is option A, wear compression stockings during the day. Compression stockings promote venous return. Wearing them during the day, combined with frequent walks and elevating the legs, effectively manages varicose veins and prevents blood pooling. Question 10. You are caring for an elderly woman who is a practicing Orthodox Jew. Which meal would you most likely offer this client? Option A, cottage cheese and mixed fruit. Option B, beef lasagna with a side salad. Option C, hamburger with a glass of milk. Option D, pork cutlet parmigiana. The correct answer is option A, cottage cheese and mixed fruit. Orthodox Judaism strictly prohibits the consumption of pork. Furthermore, dairy and meat products cannot be combined in the same meal, making cottage cheese and fruit an appropriate kosher choice. Question 11. Which of the following meals would be appropriate for a nurse to assign to an Orthodox Jewish client on a kosher diet? Option A, sweet and sour chicken with rice, vegetables, and mixed fruit. Option B, pork belly roast with rice and vegetables. Option C, crab salad on a croissant with a glass of milk. Option D, fettuccine alfredo with shrimp and iced milk tea. The correct answer is option A, sweet and sour chicken with rice, vegetables, and mixed fruit. Kosher dietary laws prohibit pork and shellfish like crab and shrimp. Furthermore, mixing meat and dairy is forbidden, making the chicken, rice, and fruit the only acceptable kosher meal. Question 12. The nurse is assisting a client of the Orthodox Jewish faith while serving lunch. A kosher meal has been delivered. What is the next appropriate action? Option A, allow the client to unwrap the utensils and prepare their own meal. Option B, unwrap the eating utensils and cut the food for the client. Option C, carefully transfer the food from the styrofoam tray to a ceramic plate. Option D, substitute the provided plastic utensils with metal hospital utensils. The correct answer is option A, allow the client to unwrap the utensils and prepare their own meal. To maintain strict kosher standards and avoid cross-contamination with non-kosher items, the client must be allowed to unwrap their own sealed utensils and prepare their own meal. Question 13. A nurse is preparing a care plan for a Jehovah's Witness client with stage 2 ovarian cancer. Knowing surgery is necessary, what religious restriction must the nurse document? Option A, blood transfusions or the administration of blood products is strictly forbidden. Option B, medication administration is entirely prohibited for this religious group. Option C, surgery of any kind is strictly prohibited by this religion. Option D, religious sacraments and traditional prayers are considered unimportant. The correct answer is option A. Blood transfusions or the administration of blood products is strictly forbidden. For Jehovah's Witnesses, undergoing surgery is permissible, but the administration of whole blood or any blood products is strictly forbidden due to their religious beliefs. Question 14. The nurse is collecting data on a newly admitted client. Which question is the most appropriate for the nurse to ask to assess the client's spirituality? Option A. What are your sources of hope and strength? Option B. Have you considered arranging a visit from members of your church? Option C. Do you attend a specific worship service any day of the week? Option D. Can you tell me about your dietary preferences and restrictions? The correct answer is option A. What are your sources of hope and strength? Spirituality refers to internal beliefs and a connection bigger than oneself, rather than structured religion. Asking about sources of hope and strength appropriately addresses their internal spiritual needs. Question 15. The nurse attends a conference on cultural considerations. Which statements are correct regarding the Amish culture? Select all that apply. Option A. Natural and alternative treatments are common in the community. Option B. The church and religion are extremely important in this community. Option C. Women and men are completely equal in making healthcare decisions. Option D. Most of the Amish community choose to purchase premium health insurance. Option E. Standard medical therapies are always prioritized over unproven treatments. The correct answers are options A and B. Natural and alternative treatments are common in the community. The church and religion are extremely important in this community. In the Amish community, natural and alternative treatments are frequently used, and the church plays a fundamental role in daily life and health crises. Question 16. The nurse is assisting in planning a community health course about preventing Lyme disease. Which of the following instructions should be included? Option A. Wear long-sleeved clothing when in heavily wooded areas. Option B. Limit your outdoor activities strictly between 10 in the morning and 4 in the afternoon. Option C. Wear wraparound sunglasses to block harmful ultraviolet rays. Option D. Apply sunscreen with a minimum sun protection factor of 30. The correct answer is option A. Wear long-sleeved clothing when in heavily wooded areas. Lyme disease is spread by deer ticks in heavily wooded areas. Wearing long sleeves, applying tick repellent, and showering after outdoor activities effectively prevent tick bites. Question 17. The nurse receives a telephone prescription from the physician for citalopram 10 mg by mouth daily. What is the absolute priority action after taking the order? Option A. Read back the prescription to the physician to verify accuracy. Option B. Verify that the medication is currently in stock at the pharmacy. Option C. Inform the client of the newly prescribed medication. Option D. Transmit the written prescription directly to the pharmacy. The correct answer is option A. Read back the prescription to the physician to verify accuracy. To prevent dangerous medication errors caused by distorted communication or background noise, the nurse must always read back the complete telephone order to the prescriber for verification. Question 18. Which advice is most appropriate for a client on neutropenic precautions who wants to learn ways to prevent infections? Option A. Avoid the use of tampons for menstrual periods. Option B. Only brush your teeth once a day or every other day. Option C. Do not let visitors come within 10 feet of your bed. Option D. Wash your hands immediately after handling household pets. The correct answer is option A. Avoid the use of tampons for menstrual periods. Tampons can cause micro tears in the vaginal canal and introduce harmful bacteria. A severely immunocompromised, neutropenic client lacks the white blood cells needed to fight off these potential infections. Question 19. The nurse is precepting a student who is collecting a swab specimen from an open wound with suspected Pseudomonas. Which action by the student requires immediate intervention? Option A. The student collects purulent drainage from the deepest part of the wound. Option B. The student flushes the wound with sterile saline prior to swabbing. Option C. The student presses and rotates the swab in the cleanest part of the wound. Option D. The student uses a standard sterile rayon swab to collect the specimen. The correct answer is option A. The student collects purulent drainage from the deepest part of the wound. Collecting purulent drainage, or pus, yields unreliable culture results because it contains dead neutrophils and debris. The wound must be cleansed first, and viable tissue swabbed. Question 20. What key educational points should the nurse reinforce with the family of a 3-year-old newly diagnosed with acute lymphoblastic leukemia? Select all that apply. Option A. The absolute importance of regular follow-ups for chemotherapy sessions. Option B. To monitor closely for signs of infection due to a weakened immune system. Option C. The possibility of hair loss as an expected side effect of chemotherapy. Option D. To encourage the child to play in crowded public parks to build immunity. Option E. To stop the chemotherapy immediately if the child develops a slight fever. The correct answers are options A and B and C. The absolute importance of regular follow-ups for chemotherapy sessions. To monitor closely for signs of infection due to a weakened immune system. The possibility of hair loss as an expected side effect of chemotherapy. Treatment requires strict adherence to chemotherapy schedules. Due to immunosuppression, monitoring for infection is critical. Alopecia is a common, distressing, but expected side effect of treatment. Question 21. The nurse is caring for a 4-year-old child in respiratory distress. The nurse should actively monitor for which frequent complication associated with tachypnea and mouth breathing. Option A. Dehydration. Option B. Sepsis. Option C. Cardiac ectopy. Option D. Renal failure. The correct answer is option A. Dehydration. Rapid breathing and mouth breathing cause significant insensible fluid losses. Because children in respiratory distress take in less oral fluid, they rapidly develop dangerous dehydration. Question 22. A mother with sickle cell anemia and a father who genetically tests negative as a carrier are having a baby. What is the exact percentage chance their baby will have sickle cell disease? Option A 0%, Option B 25%, Option C 50%, Option D 100%. The correct answer is option A, 0%. Sickle cell is an autosomal recessive disease. Since the father provides a healthy dominant gene to every offspring, the baby has a 0% chance of having the disease, but a 100% chance of being a carrier. Question 23. The nurse administered a prescribed dose of 6 units of regular insulin subcutaneously. Which subsequent data collection finding requires immediate follow-up? Option A. Cold sweats and clammy skin. Option B. Increased excessive urination. Option C. Rapid labored breathing. Option D. A sudden spike in body temperature. The correct answer is option A. Cold sweats and clammy skin. Regular insulin peaks in 2 to 4 hours. Cold sweats, clammy skin, tachycardia, and lethargy are classic, dangerous signs of severe hypoglycemia requiring immediate intervention. Question 24. The nurse collects vital signs on a client with chronic obstructive pulmonary disease who has an oral temperature of 101.4 degrees Fahrenheit. The nurse should take which action? Option A. Administer prescribed acetaminophen to reduce the fever. Option B. Provide the client with multiple warm blankets to stop shivering. Option C. Apply oxygen at 2 liters per minute via nasal cannula. Option D. Obtain a stat arterial blood gas measurement. The correct answer is option A. Administer prescribed acetaminophen to reduce the fever. An elevated temperature indicates an infection, which can trigger a severe exacerbation of chronic obstructive pulmonary disease. The priority is to administer fluids and prescribed antipyretics like acetaminophen. Question 25. The nurse is teaching a community session for clients with celiac disease. The nurse should teach that which of the following foods are safe to eat. Select all that apply. Option A. Rice. Option B. Corn. Option C. Oats. Option D. Barley. Option E. Wheat pasta. The correct answers are options A and B, rice, corn. Individuals with celiac disease must strictly avoid gluten. Rice and corn are naturally gluten-free and safe. Oats are often cross-contaminated, while barley and wheat contain gluten. Question 26. The nurse is caring for a child with cystic fibrosis at the outpatient clinic. The nurse anticipates the provider will order which routine laboratory test to monitor for a common comorbidity. Option A, blood glucose levels. Option B, 24-hour urine collection. Option C, blood cultures. Option D, liver function panel. The correct answer is option A, blood glucose levels. Cystic fibrosis causes thick mucus that damages the pancreas, frequently leading to cystic fibrosis-related diabetes. Routine monitoring of random blood glucose and hemoglobin A1C is essential. Question 27. A client with schizophrenia is taking olanzapine. Which assessment finding requires immediate follow-up by the nurse? Select all that apply. Option A, significant weight gain. Option B, reports of excessive thirst. Option C, a completely flattened effect. Option D, altered and illogical speech patterns. Option E, social withdrawal and isolation. The correct answers are options A and B, significant weight gain, reports of excessive thirst. Olanzapine is an atypical antipsychotic that causes severe metabolic syndrome, including hyperlipidemia, weight gain, and hyperglycemia. Excessive thirst indicates potential diabetes, requiring immediate follow-up. Question 28. The nurse is reinforcing teaching to a client taking phenytoin. Which over-the-counter medication should the nurse advise the client to avoid taking concurrently? Option A, calcium carbonate. Option B, acetaminophen. Option C, guaifenesin. Option D, diphenhydramine. The correct answer is option A, calcium carbonate. Calcium carbonate antacids reduce the absorption and bioavailability of phenytoin, potentially causing subtherapeutic drug levels and leading to breakthrough seizures. Doses must be separated by several hours. Question 29. The nurse is caring for a client experiencing prolonged labor with hypotonic uterine contractions. Which action should the nurse take to assist the progression of labor? Select all that apply. Option A, encourage frequent voiding to keep the bladder empty. Option B, prepare for a prescribed intravenous infusion of oxytocin. Option C, prepare for an infusion of intravenous isotonic fluids. Option D, encourage frequent maternal position changes. Option E, maintain strict continuous bed rest to conserve energy. The correct answers are options A and B and C and D. Encourage frequent voiding to keep the bladder empty. Prepare for a prescribed intravenous infusion of oxytocin. Prepare for an infusion of intravenous isotonic fluids. Encourage frequent maternal position changes. Emptying the bladder allows fetal descent. Oxytocin augments weak contractions. Hydration prevents exhaustion, and frequent position changes facilitate fetal rotation and descent. Question 30. The nurse is educating a client about a newly prescribed oxymetazoline nasal spray. What is the most critical instruction the nurse must provide? Option A. Do not use this medication for more than 3 consecutive days. Option B. Sit upright for 30 minutes after taking this medication. Option C. Change position slowly to prevent orthostatic hypotension. Option D. Rinse your mouth out thoroughly after taking this medication. The correct answer is option A. Do not use this medication for more than 3 consecutive days. Oxymetazoline is a potent topical nasal decongestant. Using it for more than 3 days causes severe rebound congestion, making the nasal passages more swollen than before. Question 31. The nurse at a health fair is talking with a perimenopausal client. Which statements by the client require immediate correction and follow-up? Select all that apply. Option A. I am using oil-based vaginal lubricants to lessen discomfort during intercourse. Option B. I stopped exercising entirely to reduce the frequency of my hot flashes. Option C. My doctor recommended I take black cohosh to help with bone density. Option D. I have started wearing layered clothing to manage sudden temperature changes. Option E. I am taking a daily calcium supplement with vitamin D. The correct answers are options A and B. I am using oil-based vaginal lubricants to lessen discomfort during intercourse. I stopped exercising entirely to reduce the frequency of my hot flashes. Oil-based lubricants can harbor bacteria and degrade condoms. Weight-bearing exercise is essential during perimenopause to maintain bone density and should never be stopped. Question 32. A client is discharged from the hospital after a new diagnosis of systemic lupus erythematosus. The client is advised to follow up with which specific test to monitor for severe organ involvement? Option A, monthly urine specimens. Option B, monthly complete blood counts. Option C, quarterly hemoglobin A1C levels. Option D, annual liver enzyme panels. The correct answer is option A, monthly urine specimens. Systemic lupus erythematosus commonly attacks the kidneys, causing life-threatening lupus nephritis. Regularly checking urine for protein and red blood cells provides early detection of renal failure. Question 33. The nurse reviews prescriptions for packed red blood cell transfusions. Which prescription should the nurse question immediately with the primary healthcare provider? Option A. A transfusion for a client presenting with acute pulmonary edema. Option B. A transfusion for a client with a documented febrile illness. Option C. A transfusion for a mechanically ventilated client. Option D. A transfusion for a client with a chest tube draining a hemothorax. The correct answer is option A. A transfusion for a client presenting with acute pulmonary edema. Packed red blood cells are a volume expander. Administering blood to a client already experiencing fluid overload and pulmonary edema can cause catastrophic respiratory failure. Question 34. The nurse reinforces teaching to a client newly prescribed methotrexate for rheumatoid arthritis. Which statements must the nurse include? Select all that apply. Option A. This medication may cause you to bruise much more easily. Option B. You will need to take a folic acid supplement with this medication. Option C. Avoid large crowds and wash your hands frequently. Option D. You must remain upright for 30 minutes after taking a dose. Option E. This medication frequently causes your gums to become enlarged. The correct answers are options A and B and C. This medication may cause you to bruise much more easily. You will need to take a folic acid supplement with this medication. Avoid large crowds and wash your hands frequently. Methotrexate is an immunosuppressant and folate antagonist that causes bone marrow suppression. Clients must avoid infection, monitor for bleeding, and take folic acid to reduce toxicity. Question 35. The nurse has just inserted an indwelling urinary catheter for a male client. To prevent urethral trauma, the nurse plans on securing the catheter tubing to the client. Option A, lower abdomen or upper thigh. Option B, inner thigh directly below the groin. Option C, medial aspect of the knee. Option D, side rail of the hospital bed. The correct answer is option A, lower abdomen or upper thigh. Securing a male urinary catheter to the lower abdomen or upper thigh eliminates traction on the urethra, preventing severe tissue necrosis and the formation of a urethral stricture. Question 36. The nurse is caring for a 3-year-old diagnosed with bronchitis. The mother asks what this means. Which response accurately explains the condition? Option A. It occurs when an infection causes inflammation in the large airways of the lower respiratory tract. Option B. It occurs when an infection causes inflammation in the small alveoli of the lower respiratory tract. Option C. It occurs when an infection causes swelling of the epiglottis in the upper respiratory tract. Option D. It occurs when an allergic reaction causes severe spasms of the trachea. The correct answer is option A. It occurs when an infection causes inflammation in the large airways of the lower respiratory tract. Bronchitis is an inflammation of the major, large conducting airways, specifically the trachea and bronchi, which are located in the lower respiratory tract. Question 37. The nurse is reviewing incident reporting protocols. Which of the following situations require the nurse to file a formal incident report? Select all that apply. Option A. A family visitor refusing to wear required personal protective equipment. Option B. A visitor intentionally pressing the button on a patient-controlled analgesia pump. Option C. A visitor stating that they tripped and fell while using the public bathroom. Option D. A visitor requesting that their family member receive scheduled pain medication. Option E. A visitor assisting their family member with brushing their teeth. The correct answers are options A and B and C. A family visitor refusing to wear required personal protective equipment. A visitor intentionally pressing the button on a patient-controlled analgesia pump. A visitor stating that they tripped and fell while using the public bathroom. Incident reports must document any unexpected event or safety violation, such as visitors refusing isolation protocols, unauthorized operation of medical equipment, or any physical injury on hospital property. Question 38. The practical nurse is reinforcing teaching to pregnant parents about antepartum testing. Which statements are accurate and should be included? Select all that apply. Option A. A non-stress test may be used to measure the fetal heart rate and well-being. Option B. Group B streptococcus screening is completed between 35 and 37 weeks. Option C. An oral glucose tolerance test will measure fetal movement at specific intervals. Option D. Amniocentesis is the primary test used to definitively diagnose preeclampsia. Option E. A biophysical profile relies exclusively on maternal blood sampling. The correct answers are options A and B. A non-stress test may be used to measure the fetal heart rate and well-being. Group B streptococcus screening is completed between 35 and 37 weeks. A non-stress test monitors fetal heart rate reactivity. Group B streptococcus is swabbed late in the third trimester to prevent neonatal sepsis during vaginal delivery. Question 39. A 6-week-old infant presents to the emergency department with a temperature of 38.7 degrees Celsius. Which diagnostic test should the nurse anticipate? Select all that apply. Option A. Complete blood count. Option B. Blood cultures. Option C. Urinalysis and urine culture. Option D. Electrocardiogram. Option E. Chest computed tomography. The correct answers are options A and B and C. Complete blood count, blood cultures, urinalysis and urine culture. A fever in an infant under 2 months of age is a medical emergency requiring a full sepsis workup, which includes a complete blood count, blood cultures, and a urinalysis. Question 40. The nurse is reinforcing teaching to a client about the newly prescribed medication epoetin alpha. Which crucial information must the nurse include? Option A. This medication may significantly raise your blood pressure. Option B. This medication will rapidly decrease your overall risk of infection. Option C. You may notice black, tarry stools while on this medication. Option D. You must take this medication with foods rich in vitamin C. The correct answer is option A. This medication may significantly raise your blood pressure. Epoetin alpha stimulates red blood cell production, rapidly expanding blood volume. This can cause severe, sudden hypertension, making blood pressure monitoring the highest priority. Question 41. The nurse prepares a client for a computed tomography scan of the abdomen and pelvis with intravenous contrast dye. The nurse should provide which specific instruction? Option A. Advise the client that they may experience a sudden warm flushing sensation during the exam. Option B. Remove all transdermal medicated patches from the body before the exam begins. Option C. Instruct the client to completely empty their bladder right before the test starts. Option D. Assess the client for an implantable pacemaker to prevent magnetic interference. The correct answer is option A. Advise the client that they may experience a sudden warm flushing sensation during the exam. Intravenous iodine contrast frequently causes a rapid, systemic vasodilation that feels like a warm, intense flush, often starting in the face and moving to the pelvis. Question 42. The nurse is caring for a client who suddenly develops a life-threatening thyroid storm. The nurse should immediately obtain a prescription for which medication? Option A. Dexamethasone. Option B. Levothyroxine. Option C. Enalapril. Option D. Epinephrine. The correct answer is option A. Dexamethasone. A thyroid storm is treated with glucocorticoids like dexamethasone, which prevent the peripheral conversion of T4 to the more active T3, rapidly reducing hypermetabolic symptoms. Question 43. The nurse is assisting a client with food choices appropriate for celiac disease. Which food items are safe and appropriate to select? Select all that apply. Option A, grilled chicken breast. Option B, scrambled eggs. Option C, beef patties without breading. Option D, whole wheat pasta. Option E, barley soup. The correct answers are options A and B and C, grilled chicken breast, scrambled eggs, beef patties without breading. Clients with celiac disease must avoid all gluten proteins found in wheat, barley, and rye. Pure meats like grilled chicken, eggs, and unbreaded beef are naturally gluten-free. Question 44. The nurse collaborates with a pharmacist to identify clients at risk for lithium toxicity. Which client is at the greatest risk for developing toxicity? Option A. A client with chronic migraines who is newly prescribed naproxen. Option B. A client with asthma taking daily short-acting bronchodilators. Option C. A client with hypertension newly prescribed a clonidine transdermal patch. Option D. A client with hypothyroidism taking daily levothyroxine. The correct answer is option A. A client with chronic migraines who is newly prescribed naproxen. Nonsteroidal anti-inflammatory drugs like naproxen drastically reduce renal blood flow, causing the kidneys to retain lithium, rapidly pushing serum lithium into the toxic range. Question 45. The nurse is observing infection control practices on the unit. Which observations require immediate correction and follow-up? Select all that apply. Option A. A client with rubella placed in a room with the door kept closed on droplet precautions. Option B. A client with Legionnaire's disease placed on strict contact precautions. Option C. A client with a rotavirus infection provided a disposable blood pressure cuff. Option D. A client with Helicobacter pylori placed on standard precautions. Option E. A client with influenza wearing a surgical mask during transport. The correct answers are options A and B. A client with rubella placed in a room with the door kept closed on droplet precautions. A client with Legionnaire's disease placed on strict contact precautions. Rubella is airborne, requiring a negative pressure room and an N95 mask, not just closed doors. Legionnaire's disease is not spread person to person and requires only standard precautions. Question 46. Which of the following are recognized potential complications of a cleft lip and cleft palate in an infant? Select all that apply. Option A. Recurrent ear infections. Option B. Severe feeding difficulties. Option C. Delayed speech and language development. Option D. Accelerated weight gain and obesity. Option E. Premature dental eruption. The correct answers are options A and B and C. Recurrent ear infections, severe feeding difficulties, delayed speech and language development. The anatomical defect allows milk to enter the eustachian tubes, causing ear infections, impairs the ability to create a vacuum for feeding, and drastically alters normal speech development. Question 47. Which of the following foods should the nurse strongly recommend to the parents of a toddler suffering from chronic constipation? Select all that apply. Option A. Whole grain bread. Option B. Black beans. Option C. Yogurt or kefir. Option D. Macaroni and cheese. Option E. Whole cow milk. The correct answers are options A and B and C. Whole grain bread, black beans, yogurt or kefir. Dietary fiber from whole grains and beans adds bulk to stool, while the probiotics in yogurt promote healthy gut motility. Dairy and cheese heavily contribute to constipation. Question 48. The nurse is managing the shift assignments. Which patient assignment is most appropriate to delegate to an unlicensed assistive personnel? Option A. A 26-year-old female requiring a one-person assist to ambulate to the restroom. Option B. A 65-year-old male requiring complex sterile dressing changes. Option C. An 80-year-old male receiving continuous enteral feedings through a nasogastric tube. Option D. A 16-year-old female who is 4 hours post-cardiac catheterization. The correct answer is option A. A 26-year-old female requiring a one-person assist to ambulate to the restroom. Assisting a stable client with ambulation and toileting is a core competency and perfectly within the legal scope of practice for unlicensed assistive personnel. Question 49. The nurse is assessing a baby diagnosed with total anomalous pulmonary venous return. The mother starts crying uncontrollably. Which statement by the nurse is the most therapeutic? Option A. I am so sorry you are going through this. Would you like to talk about it? Option B. Do not cry. I promise your baby is going to be perfectly fine. Option C. I am sure this is hard, but look how well your baby is doing right now. Option D. You think this is bad, you should see how sick the other babies here are. The correct answer is option A. I am so sorry you are going through this. Would you like to talk about it? This statement validates the mother emotional distress and uses an open-ended question to encourage dialogue, allowing her to express her fears without minimizing her feelings. Question 50. The nurse cares for a child admitted with severe dehydration secondary to gastroenteritis. Which assessment data is the most reliable indicator of the client response to intravenous fluids? Option A. The current weight compared to the admission weight. Option B. The number of diarrheal stools in the past shift. Option C. The moisture level of the oral mucous membranes. Option D. The total 24-hour urinary output. The correct answer is option A. The current weight compared to the admission weight. Daily weight is the absolute gold standard for evaluating fluid volume status. 1 kilogram of weight gained equals exactly 1 liter of fluid retained in the body. Question 51. The nurse works in a community health clinic. Which of the following statements are accurate regarding expected physical growth milestones in healthy infants? Select all that apply. Option A. Infants should double their birth weight by 6 months of age. Option B. Infants should triple their birth weight by 12 months of age. Option C. Infants should triple their birth weight by 6 months of age. Option D. Infants should quadruple their birth weight by 9 months of age. Option E. Infants typically lose 20% of their body weight in the first week. The correct answers are options A and B. Infants should double their birth weight by 6 months of age. Infants should triple their birth weight by 12 months of age. Normal infant growth parameters dictate that a baby will double their birth weight by the 6th month and triple their birth weight by their first birthday. Question 52. The nurse is caring for a client prescribed a highly potent topical glucocorticoid. The nurse should monitor for all of the following systemic side effects except: Option A. Liver toxicity. Option B. Mood changes and severe irritability. Option C. Adrenal insufficiency. Option D. Hyperglycemia and weight gain. The correct answer is option A. Liver toxicity. While topical steroids can absorb systemically, causing adrenal suppression, mood changes, and elevated blood sugar, they are not metabolized by the liver in a way that causes hepatotoxicity. Question 53. The nurse has provided medication instructions to a client prescribed venlafaxine for severe depression. Which statements indicate a correct understanding? Select all that apply. Option A. I may not notice a significant improvement in my mood right away. Option B. If I have sudden thoughts of harming myself, I should call 911. Option C. This medication will safely lower my blood pressure over time. Option D. I should stop taking the drug immediately if I feel slightly nauseous. Option E. I can drink alcohol safely in moderation while taking this pill. The correct answers are options A and B. I may not notice a significant improvement in my mood right away. If I have sudden thoughts of harming myself, I should call 911. Venlafaxine is a serotonin norepinephrine reuptake inhibitor that takes weeks to achieve efficacy. It carries a black box warning for increased suicidal ideation, requiring immediate emergency intervention. Question 54. The nurse is collecting data on a client diagnosed with schizophrenia. Which of the following negative or positive symptoms would be an expected finding? Select all that apply. Option A. Volition. Option B. Delusions. Option C. Andonia. Option D. Bradykinesia. Option E. Apraxia. The correct answers are options A and B and C. Volition, delusions, andonia. Schizophrenia presents with positive symptoms like delusions and hallucinations, and negative symptoms like avolition, lack of drive, and andonia, inability to feel pleasure. Question 55. The nurse is reinforcing education for a client diagnosed with severe obstructive sleep apnea. Which client statement indicates a correct understanding of the teaching? Option A. I will plan on exercising at least 150 minutes a week. Option B. I should use an alcohol-based antiseptic mouthwash immediately before bed. Option C. I will sleep completely flat on my back without any pillows. Option D. I have been reading about needing continuous overnight oxygen via nasal cannula. The correct answer is option A. I will plan on exercising at least 150 minutes a week. Weight loss is a pivotal treatment for obstructive sleep apnea, as reducing upper airway fat deposits improves ventilation. Exercising 150 minutes weekly meets national health recommendations. Question 56. The nurse is reviewing isolation precautions for room assignments. Which patient room assignment is inappropriate and requires immediate follow-up? Option A. A client with Lyme disease placed on strict contact precautions. Option B. A client with active tuberculosis placed in a negative pressure room. Option C. A client with influenza placed on droplet precautions. Option D. A client with human immunodeficiency virus placed on standard precautions. The correct answer is option A. A client with Lyme disease placed on strict contact precautions. Lyme disease is a tick-borne illness that cannot be transmitted from human to human. Placing this client on contact precautions is unnecessary and an inappropriate use of resources. Question 57. The nurse is preparing to insert an indwelling urinary catheter for a female client. Which action may be safely delegated to the unlicensed assistive personnel? Option A. Place the sealed urinary catheter kit at the bedside. Option B. Set up the sterile field and arrange the supplies. Option C. Explain the anatomical procedure to the client. Option D. Cleanse the urinary meatus with the iodine swabs. The correct answer is option A. Place the sealed urinary catheter kit at the bedside. Unlicensed assistive personnel cannot perform sterile procedures or provide medical education, but gathering supplies and bringing the sealed kit to the bedside is within their scope of practice. Question 58. When orienting a newly admitted older adult client to the hospital room, what is the absolute priority safety component of the admission routine? Option A. Explain how to easily operate the nurse call light. Option B. Explain how to use the bedside telephone to call family. Option C. Review the hospital's strict policy on visiting hours. Option D. Show the client how to order meals from the cafeteria. The correct answer is option A. Explain how to easily operate the nurse call light. Ensuring the client knows how to use the call light is the most critical safety priority, allowing them to summon help immediately to prevent falls or medical emergencies. Question 59. The nurse is caring for a 14-year-old scheduled for an emergency appendectomy. What is the nurse legal role regarding informed consent? Select all that apply. Option A. Validate that the parents are mentally competent to provide consent for the minor. Option B. Act as a legal witness to the parent's signature on the consent form. Option C. Review the specific surgical risks and anatomical benefits with the parents. Option D. Inform the parents that only the surgeon has the power to withdraw consent. Option E. Sign the consent form on behalf of the parents if they are running late. The correct answers are options A and B. Validate that the parents are mentally competent to provide consent for the minor. Act as a legal witness to the parent's signature on the consent form. The nurse role is to verify the client or guardian is competent, witness the signature voluntarily, and ensure they understand the procedure. The surgeon must explain the risks. Question 60. The nurse is caring for a client recovering from a diagnostic lumbar puncture. Which priority nursing intervention should be implemented immediately following the procedure? Option A. Encourage copious oral fluid intake. Option B. Test for the rapid return of the gag reflex. Option C. Elevate the head of the bed to 30 degrees. Option D. Determine if the client is positive for the Brzezinski sign. The correct answer is option A. Encourage copious oral fluid intake. A lumbar puncture removes cerebrospinal fluid. Encouraging oral fluids replaces this lost volume, significantly reducing the risk of a severe, debilitating post-dural puncture spinal headache. Question 61. The nurse is caring for clients in a long-term care facility. Which client is at the absolute greatest physiological risk for developing a severe decubitus ulcer? Option A. A 79-year-old malnourished client strictly confined to bed rest. Option B. An 80-year-old ambulatory diabetic client with peripheral neuropathy. Option C. An incontinent client who had 3 diarrheal stools this morning. Option D. An obese client who uses a wheelchair but transfers independently. The correct answer is option A. A 79-year-old malnourished client strictly confined to bed rest. Prolonged pressure from bed rest combined with malnutrition leads to rapid muscle atrophy and loss of subcutaneous fat padding, making skin breakdown and ulceration almost inevitable. Question 62. The home health nurse is visiting an 82-year-old visually impaired client who lives alone. Which statements by the client require immediate follow-up? Select all that apply. Option A. I secured my throw rugs to the floor with strong tape. Option B. I use the upstairs bathroom at night instead of the one downstairs. Option C. I switched to using an electric shaver instead of a sharp razor. Option D. I use different shaped containers with lids to organize my medications. Option E. I usually sit in a recliner while I listen to the television. The correct answers are options A and B. I secured my throw rugs to the floor with strong tape. I use the upstairs bathroom at night instead of the one downstairs. A visually impaired elderly client living alone is at extreme fall risk. Throw rugs, even taped, and navigating stairs at night are massive safety hazards requiring immediate environmental modification. Question 63. A nursing student asks the preceptor to explain the clinical definition of cyanosis. What is the most accurate response by the nurse? Option A. Cyanosis is the bluish coloring of the skin and mucous membranes indicating poorly oxygenated blood. Option B. Cyanosis means the client has been exposed to lethal cyanide poisoning. Option C. Cyanosis is the primary diagnostic indication that a client has bilateral pneumonia. Option D. Cyanosis is the red coloring of the skin in the presence of highly oxygenated blood. The correct answer is option A. Cyanosis is the bluish coloring of the skin and mucous membranes indicating poorly oxygenated blood. Cyanosis is the blue discoloration of skin, nail beds, and mucous membranes caused by a severe lack of oxygenated hemoglobin in the peripheral circulation. Question 64. The nurse is conducting presurgical assessments. Which client scenario must be reported to the surgeon immediately as it may necessitate postponing the surgery? Option A. A 40-year-old client who takes ginkgo biloba and aspirin daily. Option B. A 20-year-old client who follows a strict vegan diet. Option C. An elderly client who drinks liquid nutritional supplements daily. Option D. A healthy infant who is currently exclusively breastfeeding. The correct answer is option A. A 40-year-old client who takes ginkgo biloba and aspirin daily. Ginkgo biloba and aspirin both possess potent anticoagulant properties. Taking them together prior to surgery drastically increases the risk of catastrophic intraoperative hemorrhage. Question 65. The nurse is in a public elevator and overhears 2 staff members loudly discussing a client terminal diagnosis. This conversation violates which core ethical principle? Option A. Confidentiality. Option B. Beneficence. Option C. Autonomy. Option D. Veracity. The correct answer is option A. Confidentiality. Discussing protected health information in a public space where others can hear is a direct violation of patient confidentiality and federal privacy laws. Question 66. A client experiences severe, acute panic and anxiety before a scheduled endoscopy. Which rapid-acting medication is the physician most likely to order? Option A. Midazolam. Option B. Oxycodone. Option C. Haloperidol. Option D. Fluoxetine. The correct answer is option A, midazolam. Midazolam is a short-acting intravenous benzodiazepine that provides rapid, profound anxiolysis and conscious sedation, making it the drug of choice for acute procedure anxiety. Question 67. The nurse is working with a client suffering from severe obsessive-compulsive disorder who performs hand-washing rituals hundreds of times daily. Which interventions belong in the treatment plan? Select all that apply. Option A, create a strict schedule allowing time for the hand-washing ritual. Option B, incorporate deep breathing and meditation into their daily schedule. Option C, teach the client extensively about the physical dangers of overwashing their hands. Option D, physically restrain the client's hands when they attempt to wash them. Option E, force the client to touch dirty objects to cure the obsession quickly. The correct answers are options A and B. Create a strict schedule allowing time for the hand-washing ritual. Incorporate deep breathing and meditation into their daily schedule. Treatment involves allowing scheduled time for the compulsion to reduce acute anxiety, while gradually introducing relaxation techniques like meditation to replace the ritualistic behavior. Question 68. The nurse is caring for a client diagnosed with trichotillomania. The nurse anticipates a prescription for which class of medication to help control this disorder. Option A, fluoxetine. Option B, haloperidol. Option C, bupropion. Option D, lorazepam. The correct answer is option A, fluoxetine. Trichotillomania, or compulsive hair pulling, is classified as an obsessive-compulsive related disorder. It responds best to selective serotonin reuptake inhibitors like fluoxetine. Question 69. The nurse is collecting physical data on a client with advanced Paget disease. Which of the following skeletal findings would be expected? Option A, severe bone deformities. Option B, Heberden nodes on the fingers. Option C, Janeway lesions on the palms. Option D, a completely fused lumbar spine. The correct answer is option A, severe bone deformities. Paget disease causes accelerated, chaotic bone remodeling, resulting in structurally weak, enlarged, and severely deformed bones, most commonly affecting the skull, pelvis, and legs. Question 70. During a comprehensive physical assessment, the nurse visually inspects the client's abdomen. What specific assessment technique must the nurse perform immediately next? Option A, auscultation. Option B, percussion. Option C, deep palpation. Option D, light palpation. The correct answer is option A, auscultation. When assessing the abdomen, auscultation must always follow inspection. Palpating or percussing first can artificially stimulate bowel motility, altering the true bowel sounds. Question 71. The nurse is caring for a client diagnosed with Lyme disease exhibiting the classic bullseye rash. The nurse anticipates the provider will prescribe which antibiotic? Option A, doxycycline. Option B, simvastatin. Option C, famotidine. Option D, acyclovir. The correct answer is option A, doxycycline. Lyme disease is a bacterial infection caused by Borrelia burgdorferi. The first-line, most highly effective antibiotic treatment for this tick-borne disease is oral doxycycline. Question 72. The nurse is caring for a pediatric client with a tracheostomy tube. The client has a large volume of thick secretions. What is the absolute first action the nurse must take before suctioning? Option A, hyperoxygenate the client with 100% oxygen. Option B, ask the child to take a deep breath and cough. Option C, place the child completely flat in a supine position. Option D, notify the rapid response team for respiratory distress. The correct answer is option A, hyperoxygenate the client with 100% oxygen. Suctioning removes oxygen along with mucus, risking severe hypoxia. The nurse must always hyperoxygenate the client prior to inserting the suction catheter. Question 73. The nurse is reviewing dietary teaching with a client suffering from hypercalcemia. Which high-calcium foods must be strictly avoided? Select all that apply. Option A, broccoli. Option B, 2% milk. Option C, canned salmon with bones. Option D, whole wheat pasta. Option E, white rice. The correct answers are options A and B and C, broccoli, 2% milk, canned salmon with bones. Dairy products like milk, dark leafy greens like broccoli, and bone and fish like canned salmon are exceptionally high in calcium and must be restricted in hypercalcemia. Question 74. The nurse is providing community education to a client diagnosed with acquired immunodeficiency syndrome. Which instruction is vital to prevent opportunistic infections? Option A, clean all utensils and dishes thoroughly in hot soapy water before reusing them. Option B, do not wash your dishes in the same sink as your roommate dishes. Option C, do not use the same shower or toilet as your uninfected roommate. Option D, hand sanitizer is only necessary if you plan on physically touching someone else. The correct answer is option A, clean all utensils and dishes thoroughly in hot soapy water before reusing them. Clients with AIDS have severely compromised immune systems. Stagnant water and food particles harbor dangerous bacteria, making meticulous dishwashing essential to prevent lethal gastrointestinal infections. Question 75. As a fetus grows, the pregnant woman's center of gravity shifts forward. This compensatory spinal curvature that alters mobility is clinically known as option A, lordosis, option B, kyphosis, option C, scoliosis, option D, ankylosing spondylosis. The correct answer is option A, lordosis. To compensate for the increasing abdominal weight and shifted center of gravity, pregnant women develop an exaggerated anterior curvature of the lumbar spine known as lordosis. Question 76. The nurse is educating a group of students on basic anatomy. Which statement most accurately describes the primary function of the cardiovascular system? Option A. It is a double pump circulating oxygenated blood to the body and deoxygenated blood to the lungs. Option B. It has a heart with 6 chambers, strong vessels, and numerous one-way valves. Option C. It functions with a conduction system that exclusively originates in the ventricles. Option D. It is a single-loop system that pumps blood strictly to the brain and vital organs. The correct answer is option A. It is a double pump circulating oxygenated blood to the body and deoxygenated blood to the lungs. The heart acts as a dual pump. The right side pumps deoxygenated blood to the pulmonary circulation, while the left side aggressively pumps oxygenated blood to the systemic circulation. Question 77. The nurse receives a shift report on 4 clients. Which client requires the most immediate assessment and intervention? Option A. A client with new onset atrial fibrillation who is complaining of severe chest pain. Option B. A client who underwent surgery yesterday and is complaining of incisional pain rated 8 out of 10. Option C. A diabetic client with a foot wound and an oral temperature of 100.4 degrees Fahrenheit. Option D. A client with advanced Alzheimer's disease who is wandering the halls and confused. The correct answer is option A. A client with new onset atrial fibrillation who is complaining of severe chest pain. New onset atrial fibrillation accompanied by chest pain suggests an acute myocardial infarction or severe cardiac ischemia, which is a life-threatening cardiovascular emergency requiring instant intervention. Question 78. Which of the following statements regarding hospital response to mass casualty events are true? Select all that apply. Option A. Mass casualties are events that severely overwhelm local medical capabilities. Option B. When a mass casualty occurs, there is an immediate need to increase staff at the hospital. Option C. Many local, state, and federal agencies will collaborate to handle the situation. Option D. A mass casualty is handled exactly the same as a multi-vehicle highway accident. Option E. Hospitals rely solely on their internal emergency supplies for the duration of the event. The correct answers are options A and B and C. Mass casualties are events that severely overwhelm local medical capabilities. When a mass casualty occurs, there is an immediate need to increase staff at the hospital. Many local, state, and federal agencies will collaborate to handle the situation. Mass casualties exhaust available local resources, requiring immediate influxes of emergency staff and massive interagency collaboration to triage and treat the overwhelming number of victims. Question 79. When performing cardiopulmonary resuscitation on an unconscious infant, which specific pulse site must be palpated to assess cardiac function? Option A, brachial pulse. Option B, carotid pulse. Option C, radial pulse. Option D, pedal pulse. The correct answer is option A, brachial pulse. The brachial pulse, located on the inner upper arm, is the most accessible and reliable central pulse to palpate on a small infant during a cardiac emergency. Question 80. The nurse receives an assignment of 4 clients on the medical surgical unit. Which client must the nurse assess first based on priority frameworks? Option A. A 70-year-old female 2 days post-ankle surgery complaining of sudden shortness of breath. Option B. A 61-year-old male 1 day post-hernia repair complaining of incision pain. Option C. A 68-year-old diabetic female complaining of mild stomach discomfort. Option D. A 72-year-old male with emphysema complaining of a dull headache. The correct answer is option A. A 70-year-old female 2 days post-ankle surgery complaining of sudden shortness of breath. Using the airway, breathing, and circulation framework, the postoperative client with sudden shortness of breath is exhibiting classic signs of a lethal pulmonary embolism. Question 81. Which of the following clinical terms refers specifically to the very first thick, dark green stool passed by a newborn infant? Option A, meconium. Option B, melena. Option C, hematochezia. Option D, steatorrhea. The correct answer is option A, meconium. Meconium is the sterile, thick, tar-like substance that lines the fetal intestines during pregnancy and is passed as the newborn first stool within 24 hours of birth. Question 82. The nurse reinforces education to the parents of a toddler suffering from severe gastroesophageal reflux disease. Which statements indicate an understanding of the teaching? Select all that apply. Option A. We should feed him 6 small meals a day instead of 3 large ones. Option B. Making sure he is sitting completely upright while eating will help the reflux. Option C. He should sleep flat on his back to ensure his stomach empties easily. Option D. We will give him a large bottle of milk right before putting him to bed. Option E. We should engage him in vigorous play immediately after he eats. The correct answers are options A and B. We should feed him 6 small meals a day instead of 3 large ones. Making sure he is sitting completely upright while eating will help the reflux. Small frequent meals prevent stomach overdistension. Sitting upright utilizes gravity to keep acidic stomach contents from splashing back into the esophagus. Question 83. A 40-year-old client who is profoundly deaf and completely blind is admitted. What is the nurse's absolute primary responsibility for this client? Option A. Provide a safe, secure, and hazard-free physical environment. Option B. Continuously update the client on the hospital's social environment. Option C. Communicate any safety concerns to the nursing supervisor immediately. Option D. Make all other clients aware of this client's sensory deficits. The correct answer is option A. Provide a safe, secure, and hazard-free physical environment. For a client lacking both visual and auditory sensory input, preventing injury is paramount. Maintaining a perfectly clear, secure environment fulfills the nurse's primary duty of safety. Question 84. The nurse is ambulating a client using a gait belt when the client suddenly loses their balance and begins to fall. What is the safest action for the nurse to take? Option A. Hold the gait belt, extend one leg, let the client slide down the leg, and lower them gently to the floor. Option B. Let go of the gait belt, grab the client under their arms, and pull them backward. Option C. Grasp the gait belt and instruct the client to try to fall softly onto their side. Option D. Hold the gait belt tight and use a narrow base of support to hold the client upright. The correct answer is option A. Hold the gait belt, extend one leg, let the client slide down the leg, and lower them gently to the floor. To prevent injury to both the nurse and patient, the nurse should maintain a wide stance, extend a leg for the patient to slide down, and guide them safely to the floor. Question 85. The nurse plans care for a client with moderate Alzheimer's disease. Which environmental intervention should the nurse implement to decrease agitation? Option A. Provide a low-stimulation environment with adequate, glare-free lighting. Option B. Quiz the client frequently with orientation questions to improve memory. Option C. Change the assigned nursing staff daily to prevent caregiver burnout. Option D. Provide the client with a broad range of choices for every meal. The correct answer is option A. Provide a low-stimulation environment with adequate, glare-free lighting. Clients with dementia easily suffer from sensory overload. A low-stimulation environment with adequate lighting prevents shadows that cause frightening illusions and catastrophic behavioral reactions. Question 86. The nurse receives prescriptions for 4 newly admitted clients. Which prescription is the absolute highest priority to administer first? Option A. Aspirin to a client experiencing an acute myocardial infarction. Option B. Lisinopril to a client with essential hypertension. Option C. Risperidone to a client with an acute exacerbation of schizophrenia. Option D. Levodopa carbidopa to a client with advanced Parkinson disease. The correct answer is option A. Aspirin to a client experiencing an acute myocardial infarction. An acute myocardial infarction is a life-threatening cardiovascular emergency. Immediate administration of aspirin prevents further platelet aggregation and limits the size of the heart attack. Question 87. An adult medical surgical nurse is unexpectedly floated to the mother-baby unit. Having never cared for this population, what is the most legally appropriate action? Option A. Float to the unit and identify specific tasks within her training that she can safely perform. Option B. Refuse the assignment entirely and clock out for the day. Option C. Call the nursing supervisor and demand to be sent back to her home unit. Option D. Float to the unit but ensure no one knows about her lack of experience. The correct answer is option A. Float to the unit and identify specific tasks within her training that she can safely perform. Nurses must not refuse an assignment, but they must protect patient safety by communicating their competency limits to the charge nurse and only accepting tasks they are trained to perform. Question 88. The nurse reinforces medication instructions to a client prescribed methadone for severe opioid use disorder. Which statements indicate a correct understanding? Select all that apply. Option A. I will need mandatory counseling while taking this medication. Option B. I will need periodic blood tests while on this medication. Option C. This medication therapy may significantly lower my risk for contracting hepatitis C. Option D. I can stop taking this medication abruptly once my cravings completely disappear. Option E. This medication will completely cure my addiction within a month. The correct answers are options A and B and C. I will need mandatory counseling while taking this medication. I will need periodic blood tests while on this medication. This medication therapy may significantly lower my risk for contracting hepatitis C. Methadone maintenance requires counseling and monitoring for liver toxicity. By eliminating the need for illicit intravenous drugs, the client risk for contracting hepatitis C drops drastically. Question 89. A client with a severe crush injury to the left arm complains of intense pain 1 hour after receiving intravenous narcotics. What is the most critical next action? Option A. Ask the client to specifically describe the pain in quality and intensity. Option B. Tell the client that crush injury victims should expect to have intense pain. Option C. Offer the client a distraction, such as a book or the television. Option D. Tell the client they cannot have more medication for another 3 hours. The correct answer is option A. Ask the client to specifically describe the pain in quality and intensity. Unrelieved, severe pain following a crush injury is the cardinal sign of acute compartment syndrome. The nurse must assess the pain characteristics immediately to determine if ischemia is occurring. Question 90. The nurse is validating a client understanding of managing chronic low back pain. Which critical instruction must the nurse reinforce? Option A. Avoid bending at the waist and lifting heavy objects. Option B. Weight-bearing exercises are the best way to relieve pain. Option C. Increase your sun exposure and daily calcium intake. Option D. Lay completely flat on your stomach 4 times a day. The correct answer is option A. Avoid bending at the waist and lifting heavy objects. Bending at the waist severely strains the lumbar vertebrae and discs. Clients must be taught proper body mechanics, utilizing the knees and hips to lift objects instead. Question 91. The nurse is caring for a client receiving lorazepam for anxiety. The nurse should intervene if the client reports taking which herbal supplements? Select all that apply. Option A. Kava. Option B. Valerian. Option C. Glucosamine. Option D. Saw palmetto. Option E. Ginkgo biloba. The correct answers are options A and B, Kava, Valerian. Lorazepam is a powerful central nervous system depressant. Combining it with herbal depressants like Kava or Valerian can cause profound, life-threatening respiratory sedation and coma. Question 92. The nurse is attempting to remove an indwelling urinary catheter. The nurse aspirates 2 milliliters of fluid from the balloon, but feels resistance when pulling. What is the next action? Option A. Passively allow the syringe to further deflate the remaining fluid from the balloon. Option B. Cut the balloon inflation valve with scissors to rapidly drain the fluid. Option C. Pull firmly with steady tension until the catheter slides out of the urethra. Option D. Ask the client to bear down forcefully while the nurse pulls the tube. The correct answer is option A. Passively allow the syringe to further deflate the remaining fluid from the balloon. A standard catheter balloon holds 10 milliliters of fluid. If only 2 milliliters are removed, pulling the catheter will severely tear the urethra. The nurse must ensure complete deflation first. Question 93. 6 hours after a transurethral resection of the prostate, the client vital signs show a blood pressure of 100/60 and a heart rate of 110. The urine output is ketchup-like with large clots. The nurse suspects the client is developing Option A. Hypovolemic shock. Option B. Severe systemic sepsis. Option C. A massive pulmonary embolism. Option D. Autonomic dysreflexia. The correct answer is option A. Hypovolemic shock. Thick, ketchup-like urine with large clots indicates active, severe arterial bleeding. The combination of hemorrhage, tachycardia, and dropping blood pressure are classic signs of impending hypovolemic shock. Question 94. The practical nurse is caring for a prima gravida client undergoing a non-stress test. The results show 2 accelerations of 15 beats per minute lasting 15 seconds. How should the nurse interpret this? Option A. Interpret this result as normal and indicating fetal well-being. Option B. Anticipate an immediate order for a contraction stress test. Option C. Prepare the client for an emergency cesarean section. Option D. Interpret the result as abnormal and indicating severe fetal hypoxia. The correct answer is option A. Interpret this result as normal and indicating fetal well-being. A reactive non-stress test requires at least 2 accelerations of 15 beats above baseline for 15 seconds within 20 minutes. This is a perfectly normal, reassuring sign of fetal health. Question 95. The nurse walks into a client bathroom and observes bright sparks flying from the overhead light fixture. Which action must the nurse take absolutely first? Option A. Remove the client from the room immediately to ensure safety. Option B. Obtain a chemical fire extinguisher from the hallway. Option C. Activate the hospital-wide fire alarm system. Option D. Close the bathroom door to contain the sparks. The correct answer is option A. Remove the client from the room immediately to ensure safety. In any emergency, life safety is the ultimate priority. Following the RACE protocol, the first step is always to rescue and remove the client from immediate danger. Question 96. A client recovering from abdominal surgery has noticeable pinkish, watery fluid oozing from the fresh incision site. The nurse recognizes this exudate represents which phase of healing? Option A. The normal inflammatory exudate formation phase. Option B. A severe vascular hemorrhage response. Option C. A catastrophic failure of the wound healing process. Option D. A massive systemic bacterial infection. The correct answer is option A. The normal inflammatory exudate formation phase. Serosanguineous, or pinkish watery fluid, is a completely normal inflammatory exudate expected in the first few days of the wound healing process as the body flushes debris. Question 97. A client with a highly contagious vancomycin-resistant enterococcus infection is admitted. Which specific task can be safely delegated to the nursing assistant? Option A. Implement strict contact precautions when handling the client. Option B. Educate the client family members on ways to prevent transmission. Option C. Monitor the daily results of the laboratory culture and sensitivity tests. Option D. Collaborate with the radiology department for patient transport. The correct answer is option A. Implement strict contact precautions when handling the client. Nursing assistants cannot provide education, evaluate labs, or collaborate on care plans. However, they are required to strictly adhere to and implement prescribed contact precautions during hygiene care. Question 98. The nurse is caring for a fresh postoperative cholecystectomy client. Which interventions are appropriate to decrease the high risk of pulmonary atelectasis? Select all that apply. Option A. Encourage the patient to take deep inspirations using an incentive spirometer. Option B. Change the patient position in bed every 2 hours. Option C. Encourage the patient to cough aggressively at least 10 times an hour. Option D. Keep the patient perfectly flat in a supine position to rest the abdominal muscles. Option E. Administer high doses of intravenous opioids to suppress the cough reflex. The correct answers are options A and B and C. Encourage the patient to take deep inspirations using an incentive spirometer. Change the patient position in bed every 2 hours. Encourage the patient to cough aggressively at least 10 times an hour. Deep breathing, coughing, and frequent repositioning fully expand the alveoli, mobilize thick secretions, and prevent the collapse of lung tissue known as atelectasis. Question 99. A 12-year-old with severe asthma uses guided imagery to manage pre-attack anxiety. Which statement indicates the child perfectly understands this technique? Option A. I can do this anytime and anywhere when I start to feel anxious. Option B. I must be lying flat in a dark room to properly practice guided imagery. Option C. My mom will have to be holding my hand anytime I try this. Option D. I must play classical music every time I do my guided imagery to make it work. The correct answer is option A. I can do this anytime and anywhere when I start to feel anxious. The primary benefit of cognitive techniques like guided imagery is their absolute portability. The client can use the power of their mind to reduce stress in any location without equipment. Question 100. Which specific member of the interdisciplinary healthcare team must be consulted immediately for an infant suspected of having celiac disease? Option A. A registered dietitian. Option B. A clinical pharmacist. Option C. An occupational therapist. Option D. A speech-language pathologist. The correct answer is option A. A registered dietitian. Celiac disease requires a permanent, strict, complex gluten-free lifestyle. A registered dietitian is the sole nutritional expert qualified to educate the family on navigating this dangerous dietary restriction. Question 101. A client with a history of congestive heart failure is admitted with an acute exacerbation. Which vital sign change indicates a dangerous decompensation and potential cardiogenic shock? Option A. A sudden, severe decrease in blood pressure. Option B. A mild increase in oral temperature. Option C. A slow decrease in the respiratory rate. Option D. A gradual increase in systolic blood pressure. The correct answer is option A. A sudden, severe decrease in blood pressure. While heart failure initially causes hypertension due to fluid overload, a sudden drop in blood pressure indicates the failing heart can no longer maintain cardiac output, leading to shock. Question 102. The nurse recognizes that which of the following potent anticholinergic medications is specifically prescribed to treat severe urinary bladder urgency and incontinence? Option A, oxybutynin. Option B, dicyclomine. Option C, scopolamine. Option D, atropine. The correct answer is option A, oxybutynin. Oxybutynin is a powerful antispasmodic that relaxes the smooth muscle of the bladder detrusor, massively increasing bladder capacity and stopping the involuntary spasms causing incontinence. Question 103. The nurse is preparing to obtain vital signs for a client diagnosed with acquired immunodeficiency syndrome. Prior to entering the room, the nurse must do which of the following? Option A, perform standard hand hygiene. Option B, wear sterile gloves and an isolation gown. Option C, review the client's most recent viral load labs. Option D, obtain a completely disposable stethoscope and blood pressure cuff. The correct answer is option A, perform standard hand hygiene. AIDS is transmitted solely through blood and body fluids, not casual contact. Therefore, only standard precautions, starting with basic hand hygiene, are required for taking routine vital signs. Question 104. The nurse is caring for a group of psychiatric clients. The nurse must immediately intervene and follow up with the client who is: Option A, yelling, pacing, and shouting aggressively at the other clients. Option B, repeatedly washing their hands in the bathroom sink. Option C, voluntarily admitted and is calmly requesting discharge paperwork. Option D, sitting alone in the corner refusing to eat their lunch. The correct answer is option A, yelling, pacing, and shouting aggressively at the other clients. A client exhibiting severe aggression and shouting poses an immediate, imminent threat of physical violence to themselves and the milieu, requiring rapid de-escalation. Question 105. The licensed practical nurse is caring for a newly admitted client with a surgical tracheostomy. Which piece of emergency equipment is absolutely essential to keep at the bedside? Option A, a sterile inner cannula of the same size and one size smaller. Option B, a heated bedside air humidifier. Option C, a high-flow nasal cannula oxygen setup. Option D, a specialized tracheostomy cleaning brush. The correct answer is option A, a sterile inner cannula of the same size and one size smaller. If the tracheostomy tube becomes plugged with mucus or accidentally decannulated, the nurse must have immediate access to replacement cannulas to rapidly re-establish a patent airway. Question 106. The nurse is observing a student feed a stroke client requiring strict aspiration precautions. The nurse must immediately intervene if the student tells the client to: Option A, tilt their head completely backward when swallowing liquids. Option B, remain sitting upright for at least 30 minutes after the meal. Option C, turn their head and tuck their chin toward their chest when swallowing. Option D, avoid mixing foods of different textures in the same mouthful. The correct answer is option A, tilt their head completely backward when swallowing liquids. Tilting the head backward opens the airway, practically guaranteeing the aspiration of food or liquid into the lungs. The chin must be tucked downward to protect the trachea. Question 107. The nurse is teaching a client about a new prescription for long-acting insulin glargine. The nurse recognizes the need for further instruction when the client states: select all that apply. Option A, I will take this insulin right before my meals to cover the food. Option B, I should vigorously roll this vial of insulin before removing it with the syringe. Option C, I can only inject this insulin directly into my abdomen. Option D, this insulin will help provide a steady basal level of glucose control. Option E, I will not mix this insulin with any other insulin in the same syringe. The correct answers are options A and B and C. I will take this insulin right before my meals to cover the food. I should vigorously roll this vial of insulin before removing it with the syringe. I can only inject this insulin directly into my abdomen. Glargine is a peakless, basal insulin given once daily, not with meals. It is a clear solution that never requires rolling, and it can be injected into any approved subcutaneous site. Question 108. The nurse assists in developing a care plan for a client suffering from severe paranoia associated with schizophrenia. Which therapeutic intervention is the highest priority? Option A. Establish a consistent, trusting, non-threatening relationship. Option B. Provide physical therapeutic touch during periods of high anxiety. Option C. Set rigid limits on the client manipulative splitting behavior. Option D. Immediately physically restrain the client for any verbal aggression. The correct answer is option A. Establish a consistent, trusting, non-threatening relationship. Paranoid clients are intensely fearful and suspicious. Building a calm, reliable, non-threatening rapport is the absolute foundation required before any other therapy can be effective. Question 109. The nurse is discussing healthcare-associated infections. Which simple, cost-effective action is proven to be the absolute most effective at reducing the incidence of these infections hospital-wide? Option A. Ensure that alcohol-based hand rub dispensers are readily available in all client care areas. Option B. Require all nursing staff to don sterile gowns to change every wound dressing. Option C. Screen all newly admitted clients for colonization of methicillin-resistant bacteria. Option D. Develop policies that automatically start prophylactic antibiotics on all surgical patients. The correct answer is option A. Ensure that alcohol-based hand rub dispensers are readily available in all client care areas. Contaminated hands are the primary vector for disease transmission. Providing immediate, easy access to alcohol-based hand rubs drastically improves compliance and breaks the chain of infection. Question 110. An infant is scheduled for complex open heart surgery. After signing the consent, the mother cries, "What if my baby dies?" What is the most legally and ethically appropriate action? Option A. Notify the surgical team and have the surgeon return to speak with the mother. Option B. Explain the intricate details of the procedure to reassure the mother. Option C. Reassure the mother that everything will absolutely go as planned. Option D. Tell the mother that because she already signed the paperwork she cannot change her mind. The correct answer is option A. Notify the surgical team and have the surgeon return to speak with the mother. The mother's extreme fear indicates a lack of understanding or unresolved doubts. Only the provider performing the procedure can legally address these risks and re-establish informed consent. Question 111. Which of the following is the most anatomically appropriate position for a client undergoing a bedside thoracentesis? Option A. Sitting completely upright, leaning forward over a bedside table with arms rested and feet supported. Option B. Lying prone with both arms extended far above the head. Option C. The head of the bed flat, with the client lying completely on the unaffected side. Option D. With the head of the bed elevated 45 degrees and the client lying on the affected side. The correct answer is option A. Sitting completely upright, leaning forward over a bedside table with arms rested and feet supported. Leaning forward over a table widens the intercostal spaces, allowing the provider safe, easy access to the pleural cavity to drain excess fluid while avoiding puncture of the lung. Question 112. The nurse cares for a client with polycystic kidney disease. Which assessment finding strongly indicates the client is successfully achieving their medical treatment goals? Option A. A stable blood pressure of 128/63 mm of mercury. Option B. A critically low serum sodium level of 132 milliequivalents per liter. Option C. The presence of massive proteinuria on a routine urinalysis. Option D. A massively elevated blood urea nitrogen level. The correct answer is option A. A stable blood pressure of 128/63 mm of mercury. Polycystic kidney disease destroys renal tissue, causing severe renin-mediated hypertension. Maintaining a strictly normal blood pressure proves the treatment is successfully preserving remaining kidney function. Question 113. The nurse is conducting a physical assessment on a client with severe congestive heart failure. Which auscultated heart sound is a classic, early hallmark finding of this disease? Option A. An S3 ventricular gallop. Option B, intermittent claudication. Option C, a widened pulse pressure. Option D, a loud friction rub. The correct answer is option A, an S3 ventricular gallop. An S3 gallop occurs when blood aggressively rushes into an already overfilled, non-compliant ventricle. It is an extremely reliable, early acoustic sign of severe heart failure and volume overload. Question 114. The nurse is supervising meal trays for a client diagnosed with a catecholamine-secreting pheochromocytoma. Which dangerous dietary item must the nurse strictly remove from the tray? Option A, macaroni and aged cheddar cheese. Option B, a caffeine-free lemon lime soda. Option C, a piece of baked, unseasoned chicken. Option D, a side of steamed carrots. The correct answer is option A, macaroni and aged cheddar cheese. Pheochromocytoma causes severe, lethal hypertensive crises. Aged cheddar cheese is packed with tyramine, an amino acid that triggers massive catecholamine release, which could cause a fatal stroke. Question 115. The nurse is instructing a postoperative client on deep breathing and coughing. The client asks why they must be sitting upright. What is the most scientifically accurate response? Option A, sitting upright allows the lungs to fully expand and helps you support your incision with a pillow. Option B, sitting upright is physically much more comfortable for your back after lying down all day. Option C, sitting upright forcefully loosens respiratory secretions from the trachea. Option D, sitting upright allows you to observe your room and relax during the exercise. The correct answer is option A, sitting upright allows the lungs to fully expand and helps you support your incision with a pillow. An upright position drops the diaphragm, maximizing alveolar expansion. It also provides the mechanical leverage needed to firmly brace the incision with a pillow during a forceful cough. Question 116. An adult medical surgical nurse is assigned to float to a pediatric unit. Considering scope of practice, what is the most appropriate action for this nurse? Option A, accept the assignment, but explain the lack of pediatric experience to the charge nurse and ask for a quick orientation. Option B, refuse to take the assignment because caring for children is outside the adult medical surgical scope. Option C, take the assignment but demand the charge nurse only assign adult patients. Option D, accept the assignment, but secretly ask to be paired with a more experienced nursing assistant. The correct answer is option A, accept the assignment, but explain the lack of pediatric experience to the charge nurse and ask for a quick orientation. Nurses possess fundamental skills applicable to all ages, but they must advocate for safety. Communicating limitations and requesting orientation ensures the nurse can safely apply their skills to a new population. Question 117. The nurse is changing the diaper of a 7-month-old infant suspected of having celiac disease. The nurse notes a massive, pale, oily, incredibly foul-smelling stool. What is the clinical term for this? Option A, steatorrhea. Option B, melena. Option C, hematochezia. Option D, diarrhea. The correct answer is option A, steatorrhea. Celiac disease destroys the intestinal villi, preventing the absorption of dietary fats. These unabsorbed fats are excreted in the stool, creating the classic bulky, oily, foul-smelling steatorrhea. Question 118. A client with bright green hair states, "The lyrics on the radio are secret messages meant only for me. I use tarot cards to predict the future." Which disorder matches these findings? Option A, schizotypal personality disorder. Option B, avoidant personality disorder. Option C, schizoid personality disorder. Option D, borderline personality disorder. The correct answer is option A, schizotypal personality disorder. Schizotypal personality disorder is characterized by extreme eccentricities in appearance, magical thinking, clairvoyance, and ideas of reference, where normal events are perceived to have hidden, personal meanings. Question 119. The nurse is discussing the prevention of severe constipation with a pregnant client. What is the most biologically appropriate and safe first-line intervention to provide? Option A, significantly increase the daily consumption of high-fiber fruits and vegetables. Option B, take a powerful over-the-counter stimulant laxative every night. Option C, lie completely flat on the back for 2 hours after every meal. Option D, reduce the prescribed consumption of prenatal iron by half the amount. The correct answer is option A, significantly increase the daily consumption of high-fiber fruits and vegetables. Pregnancy hormones massively slow intestinal motility. Increasing dietary roughage and water naturally and safely adds bulk to the stool, promoting motility without the dangerous side effects of chemical laxatives. Question 120. The nurse is observing the surgical aseptic technique of a nursing student preparing a sterile field. Which action by the student requires immediate intervention and discarding of the field? Option A. The student accidentally spills sterile water directly onto the sterile drape. Option B. The student uses sterile gloves to handle the instruments on the sterile field. Option C. The student drops a package of sterile gauze cleanly into the center of the field. Option D. The student keeps the entire sterile field well above the level of their waist. The correct answer is option A. The student accidentally spills sterile water directly onto the sterile drape. Capillary action causes moisture to wick completely through a sterile drape, drawing bacteria up from the unsterile table below. A wet sterile field is instantly considered contaminated. Question 121. The nurse is caring for a client who recently had a rigid fiberglass cast applied to their right leg. Which statement by the client is an alarming medical emergency? Option A. I have been having intense, throbbing pain deep in my right calf that is not going away. Option B. My right leg feels really itchy underneath the cast material. Option C. I did not keep my leg elevated on the pillows like the doctor asked me to. Option D. When I put all my weight on my crutches, it makes the arthritis in my wrists worse. The correct answer is option A. I have been having intense, throbbing pain deep in my right calf that is not going away. Deep, unrelenting, throbbing pain in a cast extremity is the hallmark symptom of acute compartment syndrome. The cast acts as a tourniquet, cutting off arterial blood supply and killing the tissue. Question 122. Which of the following clients is at the absolute greatest physiological risk for developing profoundly impaired vascular tissue perfusion? Option A. A 60-year-old male with a 20-year history of uncontrolled hypertension. Option B. An 80-year-old female with a history of casual weekend alcoholism. Option C. A 75-year-old male with a history of basement radon gas exposure. Option D. A 59-year-old male with a history of smoking half a pack of cigarettes daily. The correct answer is option A. A 60-year-old male with a 20-year history of uncontrolled hypertension. Uncontrolled, chronic hypertension aggressively damages the endothelial lining of blood vessels, accelerating severe atherosclerosis, which drastically narrows arteries and decimates peripheral tissue perfusion. Question 123. The nurse is caring for a client receiving prescribed intravenous methylorgonavine. Which of the following assessment findings proves the medication has achieved its intended therapeutic effect? Option A. A significant decrease in severe postpartum bleeding. Option B. A massive increase in maternal blood pressure. Option C. A profound decrease in uterine muscle tone. Option D. A rapid increase in maternal urinary output. The correct answer is option A. A significant decrease in severe postpartum bleeding. Methylorgonavine is a powerful ergot alkaloid that causes intense, sustained uterine vasoconstriction and contraction. Its sole therapeutic purpose is to stop lethal postpartum hemorrhagic bleeding. Question 124. The nurse is frantically caring for a child experiencing a severe anaphylactic shock reaction. The nurse must prioritize administering which life-saving medication immediately? Option A. Intramuscular epinephrine. Option B. Intravenous diphenhydramine. Option C. Intravenous dexamethasone. Option D. High-flow nasal cannula oxygen. The correct answer is option A. Intramuscular epinephrine. Anaphylaxis causes catastrophic airway edema and cardiovascular collapse. Intramuscular epinephrine is the only drug fast and powerful enough to instantly reverse the vasodilation and bronchoconstriction. Question 125. The nurse is reinforcing education to parents following a school outbreak of pediculosis capitis. Which crucial points must be included? Select all that apply. Option A. Teach your children never to share hats, hairbands, or combs with anyone. Option B. Anyone can get head lice, it has absolutely nothing to do with being dirty or poor hygiene. Option C. Wash all bed linens, towels, and clothing the child recently used in extremely hot water. Option D. Apply the medicated permethrin cream only once and you are guaranteed to be cured. Option E. Lice can jump up to 5 feet, so keep your child isolated in a separate room. The correct answers are options A and B and C. Teach your children never to share hats, hairbands, or combs with anyone. Anyone can get head lice, it has absolutely nothing to do with being dirty or poor hygiene. Wash all bed linens, towels, and clothing the child recently used in extremely hot water. Lice are spread by direct head-to-head contact or sharing items, regardless of hygiene. Eggs, nits, survive off the host, making washing linens in hot water essential for eradication. Question 126. A 16-year-old child is brought to the emergency department after a severe tonic-clonic seizure. Which medications are specifically prescribed for the long-term, daily control of these seizures? Select all that apply. Option A. Carbamazepine. Option B. Gabapentin. Option C. Diazepam. Option D. Methylphenidate. Option E. Ethosuximide. The correct answers are options A and B. Carbamazepine, gabapentin. Carbamazepine and gabapentin are potent daily anti-epileptic drugs that stabilize neuronal membranes to prevent tonic-clonic seizures. Diazepam is for acute rescue, and ethosuximide is for absent seizures. Question 127. A pregnant client at 37 weeks gestation arrives with a severe headache, blurred vision, and excruciating epigastric pain unrelieved by medication. What lethal condition is occurring? Option A. Severe preeclampsia. Option B. Preterm labor. Option C. A ruptured ectopic pregnancy. Option D. Gestational diabetes ketoacidosis. The correct answer is option A. Severe preeclampsia. A headache, visual changes, and epigastric pain, liver swelling, are the catastrophic triad of severe preeclampsia, indicating the mother is on the verge of a lethal eclamptic seizure. Question 128. The nurse attends an education program about acute osteomyelitis. Which statement by the nurse indicates a perfect understanding of this devastating bone infection? Option A. A severe fever is present, with temperatures typically spiking greater than 101 degrees Fahrenheit. Option B. Intravenous antibiotic therapy is typically only required for 7 to 14 days. Option C. The most common microscopic cause of acute osteomyelitis is a highly virulent virus. Option D. Tiny, flat petechiae on the affected extremity are the classic hallmark finding. The correct answer is option A. A severe fever is present, with temperatures typically spiking greater than 101 degrees Fahrenheit. Acute osteomyelitis is a massive, aggressive bacterial infection deep inside the bone marrow. It triggers a profound systemic inflammatory response, classically resulting in a high, spiking fever. Question 129. A client presents to the emergency department after suffering a severe thermal burn. Which anatomical depth of injury represents a zone 2, or second-degree partial thickness burn, making it the most agonizingly painful? Option A. The dermal layer. Option B. The superficial epidermal layer only. Option C. The subcutaneous fat and muscle layer. Option D. The deepest bone and tendon tissue. The correct answer is option A. The dermal layer. Second-degree burns destroy the epidermis and aggressively expose the raw nerve endings located deep within the dermal layer, making them the most excruciatingly painful of all burns. Question 130. A 25-year-old is found unconscious in an alley with a high fever and a massive, spreading purpuric rash. Which diagnostic test is the absolute highest priority to order? Option A, stat blood cultures. Option B, a routine blood sugar check. Option C, arterial blood gas analysis. Option D, a rapid strep throat swab. The correct answer is option A, stat blood cultures. An unconscious patient with a high fever and a spreading rash is highly suspicious for lethal meningococcal sepsis. Blood cultures must be drawn instantly to identify the bacteria before starting massive antibiotics. Question 131. The nurse reinforces teaching for a client newly diagnosed with multiple sclerosis. Which statement by the client proves they deeply understand how to manage this crippling disease? Option A, carefully planning and pacing my daily activities should help manage my severe fatigue. Option B, if I experience double vision, I should tightly patch both eyes for several hours. Option C, I should plan to soak in a steaming hot bath whenever my leg muscles spasm. Option D, this disease will likely cause me to have an extreme, heightened sensitivity to pain. The correct answer is option A, carefully planning and pacing my daily activities should help manage my severe fatigue. Multiple sclerosis causes profound, debilitating nerve fatigue. Pacing activities and taking scheduled rest periods is the primary lifestyle modification. Hot baths actually trigger massive symptom exacerbations. Question 132. The nurse is caring for an older male client prescribed dutasteride. The nurse understands this medication has successfully achieved its therapeutic effect when the client reports. Option A, a significant decrease in symptoms of urinary retention. Option B, a complete cessation of severe nighttime heartburn and pyrosis. Option C, a sudden, massive increase in baseline anxiety levels. Option D, a dramatic reduction in lower extremity pitting edema. The correct answer is option A, a significant decrease in symptoms of urinary retention. Dutasteride blocks the conversion of testosterone, actively shrinking the massively enlarged prostate gland in benign prostatic hyperplasia, thereby relieving the crushing pressure on the urethra and stopping urinary retention. Question 133. The nurse reinforces teaching regarding a new prescription for the antipsychotic risperidone. Which statement by the client is completely inaccurate and requires immediate correction? Option A, I will need to have my blood drawn weekly to strictly monitor my white blood cells. Option B, I should immediately report any abnormal, jerky muscle movements that I develop. Option C, if I get severe, rigid muscle stiffness, I should notify my physician instantly. Option D, I will need to chew sugarless gum constantly if I develop a severely dry mouth. The correct answer is option A, I will need to have my blood drawn weekly to strictly monitor my white blood cells. Risperidone does not cause severe agranulocytosis. The requirement for strict, weekly white blood cell monitoring is exclusively associated with the highly toxic atypical antipsychotic, clozapine. Question 134. During active labor, the nurse notes the fetal heart rate drops from 150 to 120 beats per minute precisely as the contraction begins, and returns to baseline exactly as it ends. This pattern is: Option A, an early deceleration. Option B, a late deceleration. Option C, moderate baseline variability. Option D, marked baseline variability. The correct answer is option A, an early deceleration. Early decelerations perfectly mirror the contraction. They are a harmless, normal vagal response caused by the intense pressure of the maternal pelvis squeezing the fetal head during descent. Question 135. The nurse reinforces discharge instructions for a client newly prescribed the cardiac glycoside digoxin. Which statements prove the client understands the lethal risks of this drug? Select all that apply. Option A, if I note strange color vision changes or yellow halos, I will call my doctor right away. Option B, I will check my pulse before each dose, and if it is less than 60, I will hold the pill. Option C, I will make absolutely sure I get enough potassium in my daily diet. Option D, I will increase my daily calcium intake significantly to help my heart pump. Option E, the water pills I take will decrease the chance of having any side effects. The correct answers are options A and B and C. If I note strange color vision changes or yellow halos, I will call my doctor right away. I will check my pulse before each dose, and if it is less than 60, I will hold the pill. I will make absolutely sure I get enough potassium in my daily diet. Visual disturbances and bradycardia are classic signs of digoxin toxicity. Hypokalemia, often caused by water pills, violently triggers this toxicity, so dietary potassium must be maintained. Question 136. A client metabolic panel reveals a critically high serum chloride level of 115 milliequivalents per liter. The nurse anticipates the physician will aggressively order which intravenous treatments. Select all that apply. Option A, intravenous sodium bicarbonate. Option B, intravenous lactate Ringer's solution. Option C, intravenous normal saline. Option D, intravenous carbonic anhydrase inhibitors. Option E, intravenous concentrated potassium chloride. The correct answers are options A and B, intravenous sodium bicarbonate, intravenous lactate Ringer's solution. Hyperchloremia induces severe metabolic acidosis. Bicarbonate directly neutralizes the acid, and lactate Ringer's provides a balanced, low chloride fluid that the liver converts into more bicarbonate. Question 137. The infection control nurse is analyzing unit data to prevent hospital-acquired infections. Which specific client condition possesses the absolute highest statistical risk for developing a lethal urinary tract infection? Option A. A bed-bound client with a chronic, long-term indwelling urinary catheter. Option B. An obese client being aggressively treated for urge incontinence with pads. Option C. A diabetic client receiving strong intravenous antibiotics for a foot wound. Option D. A young female client with a childhood history of frequent bladder infections. The correct answer is option A, a bed-bound client with a chronic, long-term indwelling urinary catheter. An invasive, indwelling urinary catheter provides a direct, unhindered highway for aggressive bacteria to bypass the body's natural defenses and heavily colonize the bladder within 48 hours. Question 138. The nurse is reviewing discharge instructions with the parents of a toddler recovering from a high fever. What critical points must the nurse aggressively reinforce? Select all that apply. Option A. The exact temperature threshold that requires immediate emergency medical attention. Option B. The appropriate, safe pharmacological and physical methods for managing a fever at home. Option C. The severe signs of dehydration, like lack of tears or dry mouth, to constantly monitor for. Option D. Specific warning signs, like a stiff neck or rash, that indicate a lethal underlying condition. Option E. To plunge the child into an ice-cold bath to rapidly drop the fever. The correct answers are options A and B and C and D. The exact temperature threshold that requires immediate emergency medical attention. The appropriate, safe pharmacological and physical methods for managing a fever at home. The severe signs of dehydration, like lack of tears or dry mouth, to constantly monitor for. Specific warning signs, like a stiff neck or rash, that indicate a lethal underlying condition. Parents must know when a fever becomes an emergency, how to dose antipyretics safely, and how to spot dehydration or meningitis. Ice baths cause violent shivering, spiking the temperature further. Question 139. The nurse is educating parents on proper, healthy nutrition for their rapidly growing toddler. Which evidence-based nutritional guidelines should be included? Select all that apply. Option A. Whole cow milk can be offered daily to provide essential calcium and vitamin D. Option B. Roasted or baked vegetables are highly preferred over vitamin-depleted fried vegetables. Option C. Using sweet foods as a reward is a highly effective, positive behavioral incentive. Option D. Good iron-rich food choices include high-water fruits like melon and strawberries. Option E. Toddlers should drink at least 4 cups of sugary fruit juice every day for energy. The correct answers are options A and B. Whole cow milk can be offered daily to provide essential calcium and vitamin D. Roasted or baked vegetables are highly preferred over vitamin-depleted fried vegetables. Whole milk provides the dense fat required for toddler brain development, and roasting vegetables preserves vital nutrients without adding toxic trans fats. Question 140. The nurse observes a 2-year-old client exploring the clinic room, demanding to do things by themselves, and throwing a tantrum when stopped. According to Erickson, this toddler is mastering which psychosocial stage? Option A, autonomy versus shame and doubt. Option B, trust versus mistrust. Option C, initiative versus guilt. Option D, industry versus inferiority. The correct answer is option A, autonomy versus shame and doubt. Between ages 1 and 3, toddlers aggressively seek independence and personal control over their environment. Success builds autonomy, excessive restriction breeds shame and crippling self-doubt. Question 141. The nurse is caring for a client recently diagnosed with pernicious anemia. Because the client's stomach lacks intrinsic factor, the nurse anticipates a lifelong prescription for which specific, critical medication? Option A, intramuscular cyanocobalamin. Option B, intravenous iron dextrin. Option C, oral folic acid supplements. Option D, oral thiamine replacements. The correct answer is option A, intramuscular cyanocobalamin. Pernicious anemia is an autoimmune destruction of gastric parietal cells, making the absorption of dietary vitamin B12 impossible. The client requires lifelong, direct parenteral injections of cyanocobalamin. Question 142. A nurse is counseling an obese client on extreme weight loss methods. Which statement by the nurse accurately describes the intense medical nature of a very low-calorie diet? Option A. This extreme diet can only be safely utilized when there is strict, close medical supervision. Option B. This is a simple, long-term treatment measure for people who just cannot lose weight. Option C. A very low-calorie diet contains almost absolutely no protein to force fat burning. Option D. This diet consists strictly of solid foods that are heavily pureed to speed up digestion. The correct answer is option A. This extreme diet can only be safely utilized when there is strict, close medical supervision. Providing less than 800 calories a day causes massive physiological shifts. Without strict medical monitoring, these diets can trigger lethal electrolyte abnormalities, arrhythmias, and sudden cardiac death. Question 143. A client is admitted to the burn unit with catastrophic full-thickness burns covering 25% of their total body surface area. Which immediate, life-saving actions must the nurse take? Select all that apply. Option A, keep the client strictly nothing by mouth to prevent aspiration and ileus. Option B, obtain a continuous 12-lead electrocardiogram to monitor for lethal arrhythmias. Option C, obtain a stat arterial blood gas to assess for severe systemic acidosis and hypoxia. Option D, prepare to infuse hypertonic 3% saline to aggressively pull fluid from the tissues. Option E, aggressively irrigate the deep burns with harsh chlorhexidine soap. The correct answers are options A and B and C. Keep the client strictly nothing by mouth to prevent aspiration and ileus. Obtain a continuous 12-lead electrocardiogram to monitor for lethal arrhythmias. Obtain a stat arterial blood gas to assess for severe systemic acidosis and hypoxia. Massive burns cause systemic shock, shutting down the gut, requiring NPO status. The massive tissue destruction releases potassium, risking lethal arrhythmias, while smoke inhalation necessitates urgent ABG monitoring. Question 144. The emergency department nurse is triaging a young female client. Which of the following subtle, hidden signs would lead the highly trained nurse to suspect the presence of severe physical abuse? Select all that apply. Option A, unexplained bruises in multiple stages of healing and repeated broken bones. Option B, a history of multiple, closely spaced, unintended pregnancies. Option C, a documented history of severe, chronic alcoholism or substance abuse. Option D, a frequent, routine visits for minor upper respiratory infections. Option E, a completely up-to-date and meticulously maintained vaccination record. The correct answers are options A and B and C, unexplained bruises in multiple stages of healing and repeated broken bones. A history of multiple, closely spaced, unintended pregnancies. A documented history of severe, chronic alcoholism or substance abuse. Abusers often use sexual violence, unintended pregnancies, and physical trauma, bruises. Victims frequently turn to severe substance abuse to cope with the inescapable psychological trauma. Question 145. The nurse is collecting comprehensive data on a client suffering from undiagnosed celiac disease. Which classic, destructive gastrointestinal and systemic findings would be expected? Select all that apply. Option A, profound systemic dehydration. Option B, chronic nausea and severe vomiting. Option C, massive, painful abdominal distension. Option D, an intensely itchy, blistering skin rash. Option E, a sudden, massive increase in appetite and weight gain. The correct answers are options A and B and C and D, profound systemic dehydration, chronic nausea and severe vomiting, massive, painful abdominal distension, an intensely itchy, blistering skin rash. Gluten triggers an autoimmune destruction of the gut, causing severe malabsorption, distension, nausea, dehydration, and a blistering autoimmune rash known as dermatitis herpetiformis. Question 146. The nurse is caring for a client prescribed subcutaneous enoxaparin for deep vein thrombosis prophylaxis. The nurse knows it is absolutely critical to monitor which specific laboratory value for a lethal complication. Option A, the total platelet count. Option B, the international normalized ratio. Option C, the serum cardiac troponin level. Option D, the activated partial thromboplastin time. The correct answer is option A, the total platelet count. Enoxaparin can trigger heparin-induced thrombocytopenia, a paradoxical, lethal immune reaction that aggressively destroys platelets and causes massive, widespread blood clotting. The platelet count must be monitored. Question 147. The intensive care nurse is advocating for meticulous oral care for an intubated, critically ill client. What are the proven, life-saving benefits of this routine procedure? Select all that apply. Option A, it drastically contributes to a decreased incidence of lethal aspiration pneumonia. Option B, it successfully prevents the painful, destructive deterioration of the oral cavity. Option C, it promotes the conscious client overall psychological sense of well-being and comfort. Option D, it naturally lowers the client core body temperature during a high fever. Option E, it completely eliminates the need for any future intravenous antibiotics. The correct answers are options A and B and C. It drastically contributes to a decreased incidence of lethal aspiration pneumonia. It successfully prevents the painful, destructive deterioration of the oral cavity. It promotes the conscious client overall psychological sense of well-being and comfort. The mouth harbors massive amounts of virulent bacteria. Meticulous oral care stops these bacteria from colonizing the ventilator tube and sliding into the lungs, preventing deadly ventilator-associated pneumonia. Question 148. The practical nurse is discharging a toddler following the complex surgical repair of an imperforate anus. What realistic, critical educational points must be reinforced with the anxious parents? Select all that apply. Option A, normal, healthy bowel habits can absolutely be established for your toddler over time. Option B, be prepared that achieving complete toilet training will take significantly longer for your child. Option C, you must force your child to be fully toilet trained before kindergarten starts. Option D, daily, aggressive bowel irrigations will permanently cure the underlying nerve damage. Option E, the child will eventually require a permanent, lifelong abdominal colostomy bag. The correct answers are options A and B. Normal, healthy bowel habits can absolutely be established for your toddler over time. Be prepared that achieving complete toilet training will take significantly longer for your child. Surgical repair creates a functional anatomy, but the surrounding muscles and nerves are often weak. With intense patience, bowel control is possible, but toilet training is notoriously delayed. Question 149. The nurse reinforces medication instructions to a client newly prescribed the ACE inhibitor enalapril. Which specific statement proves the client understands the most lethal adverse effect of this drug? Option A. I will notify my prescriber immediately or call 911 if I develop any swelling of my face. Option B. I will rigidly need to weigh myself every single day while taking this medication. Option C. I should aggressively eat foods high in potassium while I am taking this medication. Option D. I will need lab work done every month to evaluate if my liver is failing. The correct answer is option A. I will notify my prescriber immediately or call 911 if I develop any swelling of my face. Enalapril can cause angioedema, a sudden, massive, unpredictable swelling of the face, lips, and airway that can cause catastrophic asphyxiation and death within minutes. Question 150. The nurse is assisting in the care of a client newly diagnosed with Bell palsy. Because the facial nerve is paralyzed, which nursing diagnosis is the absolute highest safety priority for this client? Option A. Risk for severely disturbed sensory perception and corneal damage. Option B. Risk for a massive systemic bacterial infection. Option C. Risk for a profoundly disturbed body image and depression. Option D. Risk for entirely ineffective cerebral tissue perfusion. The correct answer is option A. Risk for severely disturbed sensory perception and corneal damage. Bell palsy paralyses the eyelid, preventing the eye from blinking or closing. This sensory loss leaves the cornea completely exposed to drying, scratching, and permanent blinding ulcerations. Question 151. The nurse is assisting with the care of a client who has a chest tube draining a large pneumothorax. Which critical, life-saving interventions must be implemented continuously? Select all that apply. Option A. Periodically physically check that all plastic connections are tightly and securely taped. Option B. Check the entire length of the tubing frequently for dangerous kinks and dependent fluid loops. Option C. Tape the drainage tubing rigidly to the side of the hospital bed to prevent pulling. Option D. Aggressively strip and milk the tubing every hour to forcefully dislodge blood clots. Option E. Clamp the chest tube securely whenever the patient is transported down the hallway. The correct answers are options A and B. Periodically physically check that all plastic connections are tightly and securely taped. Check the entire length of the tubing frequently for dangerous kinks and dependent fluid loops. Loose connections allow lethal air to suck back into the chest. Kinks or fluid-filled loops block drainage, causing pressure to build up and trigger a catastrophic tension pneumothorax. Question 152. The physician prescribes a continuous intravenous infusion of lidocaine at 2 mg per minute to treat a lethal ventricular arrhythmia. The bag contains 1 gram of lidocaine and 500 milliliters of normal saline. How many milliliters per hour will the infusion pump deliver? Option A. 60 milliliters per hour. Option B. 30 milliliters per hour. Option C. 120 milliliters per hour. Option D. 90 milliliters per hour. The correct answer is option A. 60 milliliters per hour. 1 gram equals 1000 milligrams. 500 milliliters divided by 1000 milligrams equals 0.5 milliliters per milligram. 2 milligrams per minute times 60 minutes equals 120 milligrams per hour. 120 times 0.5 equals 60 milliliters per hour. Question 153. The nurse meticulously reviews the clinical data for a client exactly 24 hours postpartum following a difficult vaginal delivery. Which specific finding is highly abnormal and requires immediate physician follow-up? Option A. A capillary blood glucose level randomly reading 258 mg per deciliter. Option B. A white blood cell count elevated to 14,000 per cubic millimeter. Option C. A total measured urinary output of exactly 60 milliliters over the last hour. Option D. A core body temperature reading of 99.9 degrees Fahrenheit. The correct answer is option A. A capillary blood glucose level randomly reading 258 mg per deciliter. While mild fever, diuresis, and leukocytosis are completely normal physiological responses to the massive trauma of childbirth, a random blood glucose over 200 indicates severe, dangerous hyperglycemia. Question 154. The nurse is educating a client on the exact difference between modifiable and non-modifiable health risk factors. Which of the following is the best example of a heavily modifiable risk factor? Option A, personal daily lifestyle choices and dietary habits. Option B, a strong genetic predisposition to cardiovascular disease. Option C, a severely traumatic childhood environmental exposure. Option D, a deeply ingrained clinical diagnosis of clinical depression. The correct answer is option A, personal daily lifestyle choices and dietary habits. Lifestyle choices, such as smoking, diet, and exercise, are fully within the client control to change, making them the ultimate modifiable risk factors for preventing chronic disease. Question 155. The nurse walks into the room of a teenager recovering from a highly vascular tonsillectomy and sees the client aggressively eating sharp, crunchy tortilla chips. What is the most clinically appropriate and urgent response? Option A. Those chips are really hard on the back of your throat where you had surgery. I am worried they could cause you to bleed. Let us get something softer. Option B. You absolutely cannot eat anything solid yet. I am sorry, but I have to take those away. Option C. Chips are not a good choice right now because you desperately need a high-protein diet to heal. Option D. I love that restaurant. Their chips are so good, just chew them up really well. The correct answer is option A. Those chips are really hard on the back of your throat where you had surgery. I am worried they could cause you to bleed. Let us get something softer. A tonsillectomy leaves the throat raw and highly vascular. Sharp foods like chips can violently rip open the surgical scabs, causing a massive, life-threatening arterial hemorrhage. Question 156. The nurse aggressively reviews the morning medication prescriptions for assigned clients. Which specific prescription is clinically dangerous and must be clarified with the physician immediately? Option A, albuterol administered via nebulizer for a patient admitted with severe hypokalemia. Option B, clozapine administered by mouth for a patient with severe, treatment-resistant schizophrenia. Option C, lisinopril administered by mouth for a patient with chronic congestive heart failure. Option D, verapamil administered by mouth for a patient with debilitating migraine headaches. The correct answer is option A, albuterol administered via nebulizer for a patient admitted with severe hypokalemia. Albuterol is a potent beta agonist that aggressively forces serum potassium into the cells. Giving it to a patient who is already hypokalemic can trigger a lethal cardiac arrest. Question 157. A client with a suspected massive femoral artery occlusion is screaming in agony. The leg is pale, cold, and pulseless. What is the absolute first, most critical action the nurse must take? Option A, immediately notify the primary healthcare provider or activate the rapid response team. Option B, aggressively elevate the affected leg high above the level of the heart to drain the blood. Option C, perform vigorous passive range of motion exercises to force blood into the leg. Option D, apply a tightly wrapped, hot, wet compress to the leg to massively dilate the vessels. The correct answer is option A, immediately notify the primary healthcare provider or activate the rapid response team. An arterial occlusion is a catastrophic medical emergency. Without immediate surgical intervention to restore blood flow, the entire limb will suffer irreversible necrosis and require amputation. Question 158. A nurse refuses to administer an unverified, massive dose of medication ordered by an exhausted physician, ultimately preventing a lethal overdose. This action perfectly exemplifies which core ethical principle of nursing? Option A, non-maleficence. Option B, fidelity. Option C, veracity. Option D, beneficence. The correct answer is option A, non-maleficence. Non-maleficence is the fundamental ethical mandate to do no harm. By refusing to administer a dangerous order, the nurse actively protected the client from catastrophic injury. Question 159. The nurse is auscultating the lungs of a child diagnosed with a severe coarctation of the aorta. The nurse notes heavy, wet crackles and rales in the lung bases. The nurse knows this lethal sound is caused by option A, severe pulmonary fluid congestion from left-sided heart failure. Option B, a massive foreign body blocking the primary bronchus. Option C, a severe, community-acquired bacterial pneumonia infection. Option D, massive systemic venous congestion backing up from the liver. The correct answer is option A, severe pulmonary fluid congestion from left-sided heart failure. Coarctation severely blocks blood from leaving the left ventricle. This immense pressure causes blood to forcefully back up into the lungs, flooding the alveoli and causing lethal pulmonary edema. Question 160. The nurse receives a critically alarming laboratory result for a client in end-stage renal disease. The hemoglobin is 5.2 grams per deciliter and the hematocrit is 16%. The nurse immediately anticipates an emergency transfusion of option A, packed red blood cells. Option B, fresh frozen plasma. Option C, concentrated platelets. Option D, human serum albumin. The correct answer is option A, packed red blood cells. A hemoglobin level below 7 grams per deciliter indicates profound, life-threatening anemia. Packed red blood cells must be transfused immediately to restore the blood oxygen carrying capacity.